biggest problem we have is that an underpaid, understaffed medical practice. When you have a broke doctor whose option is either to give you $1,000 treatment or $100 treatment, and he needs some money because he's underpaid, that is a big problem we have. You need to create a medical system that supports the doctor to live up to his Hippocratic oath. And that's the part we need to fix in our medical system. And I'm not defending these very medical practitioners, but when you empathize with them, you can start to see how easy it is to fall for that trap where you feel you're a bit cold, and that's why the nasty experiences are all over. Doctors will treat you different when you're on insurance and when you're not. When you actually, sadly, when you have no insurance in this market, you have a higher chance of survival. Because they kind of jitter around taking all your money. I did travel, and I also did a lot of research about the US and Europe. And you'd find people on average who are cancer survivors 10 years, 5 years, 30 years, 20 years. I met a 40-year survivor in India. Met a 30-year survivor in India. In our market, I challenge you to show me how many 5-year survivors you know. I doubt they can pass 2-digit numbers. This is a problem, and we need to speak about it. And we speak about it as a community without accusing. Because right now what happens is that the doctors blame the government for resources. The government blames the doctors. The public has no one to blame. And these are things that we need to have a conversation. And that's one of the things that I'm trying to get people talking about. You have to have experienced death. Personally, this is my personal opinion. You have to have experienced death for you to give therapy to anyone who is facing death. Hospitals, communities, neighborhoods, people who have been bereaved or are dealing with sick, form groups. And those are usually, in my opinion, the best people to explain the emotion. Because the caregiver is really the one who holds everything together in terms of maintaining emotional sanity, in terms of giving guidance, in terms of pulling financial resources or being the center of the coordinator of the financial resources at this same time, dealing with other affected parties like children. When my wife lost her father 2 weeks into our marriage, and I loved her very much, and I was there. I didn't understand what she was going through. To me, she was taking too long. She was being fussy. She was overreacting. You know, it's very hard to relate. But when you've gone, you understand that when you've gone through it, you understand that people require silence. People don't want to hear cliche statements. People want to grieve in their own way. People want zero judgment. People want to wail. Kanini for Africa Foundation. So we had always talked about it, and of course seeing the support Janet got and the number of people who started looking at her as a source of health information, awareness on cancer, and Janet did quite a lot of work. So the foundation was formed to do a couple of things. One, awareness. A big problem is awareness. I always say cancer is where HIV was 25 years ago. It was as standard death sentence. So if we can get people talking about it, the fact that there are not only 2 types of cancers, there are over 250 types of cancers. How do you diagnose them? How do you treat them and all that? And people just get talking about it. And that will help really a big problem in our country. If you ask the Indian doctors or the guys in the US or the UK, the problem is that most patients who leave Kenya to go to these places for health purposes are usually too late because they were not diagnosed in good time. And if you walk around and you hear there's cancer testing going on, it's usually for breast and prostate. There are many alternatives to treatment. I'm not pro or for any, but I would rather the discussion be had. I was arguing with somebody, just deploying a radiotherapy machine in a hospital does not cure cancer. You need to understand what that machine does. So Janet and I got to start it. Unfortunately, she had just started the work when she passed on. And for me, for my therapy also, is to really, one of the promises I made at her funeral is to carry on her work and her legacy and make sure she didn't die in vain. And that's Kanini for Africa.